The Code Purple Project presents The Science of Medication for Mental Illness, How It Really Works. Mental illness is one of the most misunderstood aspects of human health, and yet it affects millions of people around the world, quietly, often invisibly, but powerfully. When someone is diagnosed with a mental illness, one of the first treatment options usually discussed is medication. But how do these medications actually work? Are they just numbing agents? Do they change who you are? Or is there real measurable science behind the pills? In this video, we're going to break down the science of psychiatric medication, what it does in the brain, why it helps some people and not others, and the truth about how it fits into the bigger picture of mental health care. Let's begin with the basics. Our brain is made up of billions of neurons, and these neurons communicate through chemicals called neurotransmitters. Think of neurotransmitters as messengers. They carry signals from one brain cell to another. Some well-known neurotransmitters include serotonin, dopamine, norepinephrine, and GABA. These chemicals influence our mood, thoughts, energy levels, motivation, anxiety, and even sleep. When something goes wrong in this chemical messaging system, it can result in various mental health conditions. For example, depression has been linked to low levels of serotonin and norepinephrine. Anxiety disorders often involve imbalances in GABA or an overactive fight or flight response. Schizophrenia is thought to involve irregular dopamine signaling. Medications are designed to help restore balance to these systems. Let's take antidepressants, for example. The most common class is called SSRIs, or selective serotonin reuptake inhibitors. Medications like fluoxetine, commonly known as Prozac, work by increasing the amount of serotonin available in the brain. Normally, after serotonin is released, it's quickly reabsorbed by the neuron that sent it out. SSRIs block that reabsorption, allowing more serotonin to stay in the brain longer. This doesn't create a false high, but it can help stabilize mood over time. Importantly, these medications don't work instantly. It often takes 4 to 6 weeks before people feel the full effects. That's because the brain needs time to adapt to the chemical changes and build new neural pathways. Antipsychotics, used for conditions like schizophrenia and bipolar disorder, work a bit differently. These medications often target the dopamine system. In schizophrenia, dopamine activity is excessive, leading to hallucinations, delusions, and disorganized thinking. Antipsychotics reduce the sensitivity of dopamine receptors, especially in brain areas involved in emotion and thought. Atypical antipsychotics like olanzapine or risperidone also affect serotonin, which helps with mood stabilization. These drugs can be life-saving, but they can also bring side effects like weight gain, sedation, or movement disorders, so medical supervision is crucial. For anxiety disorders, medications like benzodiazepines and SSRIs are often used. Benzodiazepines, such as diazepam or lorazepam, work by enhancing the effect of GABA, the brain's calming chemical. They help reduce acute, intense anxiety quickly, but aren't meant for long-term use due to the risk of dependency. On the other hand, SSRIs are used for long-term management of anxiety. They help regulate the brain's chemical environment and reduce the chronic activation of anxiety circuits, making them suitable for conditions like generalized anxiety disorder, panic disorder, or PTSD. Stimulants are another category, commonly prescribed for ADHD. Medications like methylphenidate, Ritalin, or amphetamine salts, Adderall, increase dopamine and norepinephrine in the brain's prefrontal cortex, the area responsible for attention, decision-making, and impulse control. These medications help people with ADHD focus better and improve executive functioning. Contrary to myths, they often have a calming effect in those with ADHD rather than causing overstimulation. It's crucial to address a common misconception. Medication is not a cure for mental illness. It is a tool, and often a very powerful one, but it works best when combined with other treatments like therapy, lifestyle changes, social support, and self-awareness. Mental illness is not caused solely by a chemical imbalance. Trauma, genetics, stress, and environment all play major roles. Medications help regulate the chemical piece, but they can't fix everything on their own. You might ask, why do these medications work for some and not others? The answer is in our biology, metabolism, and genetics. Some people process medications faster. Others have genetic differences that make them more or less responsive. That's why finding the right medication often involves trial and error. The field of precision psychiatry, which uses genetic testing to guide prescriptions, medications is still growing and may change how we treat mental illness in the future. Of course, side effects are always a concern. These can include nausea, fatigue, weight changes, sexual side effects, and emotional dullness. Antipsychotics in particular can come with more serious risks. That's why open communication with a doctor, close monitoring, and regular check-ins are essential. And remember, never stop psychiatric medications abruptly. This can lead to withdrawal symptoms or relapse. So what does all this mean? The science of medication for mental illness is not simple, but it's real, evidence-based, and life-changing for many. These medications aren't magic, but they're not fake either. They are built on decades of neuroscience and have helped millions of people live more balanced lives. For some, they're essential to stability. For others, they're one part of a much larger healing journey. If you're struggling with mental health, know this: it's okay to ask questions. It's okay to seek support, and it's okay to consider medication as one of many tools in your journey. If this video helped you better understand the science behind psychiatric medications, please consider subscribing to the Code Purple Project, where we break down the most misunderstood topics in mental health and healing. Your brain matters, your story matters, and you're not alone.